I'm Shelley Rotondo, and I'm the CEO of Northwest Harvest. And I'm humbled and I'm honored to lead such a vital organization at this milestone in its history.
Thank you, thank you, thank you. Well, thank you for being here. It's a great opportunity for us to talk about Northwest Harvest, to celebrate the anniversary, and to talk about where we go from here. Every year when the food drive is over, we kind of ask ourselves, were some of those same people here year after year, the people in the lines, the people donating food, and is the need getting any smaller year after year? Are there things that we can do to go upstream and find out why so many people, and in some cases so many more people from year to year, are hungry and are in the food lines and are waiting at the food banks? What can we do about looking at the root causes of hunger?
For 50 years, this organization has been fighting to end hunger and the root causes of hunger. You're doing this because you're dedicated to, I think, what is at the core of what it means to be a good human being and citizen. And that's a core of compassion and empathy, caring for those in our community, and especially helping those who are less fortunate than us. So I was a judge on the cooking competition show Chopped. The competitors were school chefs. And one of the chefs, her name was Cheryl Barbara from high school in the community in Connecticut. And so for the main course, the sort of one of the mystery ingredients was quinoa. And, but Cheryl made this delicious pasta. It was a pappardelle with sausage and rapini, a broccoli rabe, Parmesan cheese. It was crazy good. And I was like impressed, like restaurant quality good, except she just sort of threw in the quinoa into this dish, like basically raw, which was strange, of course. Strange choice she made. Why you put a grain into a pasta, and I was trying to figure it out. It really didn't make much sense. And so, you know, in Chopped, you're supposed to be kind of like, have a little attitude as the judge. And so, you know, I sort of questioned her, like, well, why would you make such a decision? Sort of implying that it was a mistake. And she told me, like, sort of bluntly, that she really didn't have any idea what quinoa was, but that it was Monday, and that on Monday she always cooked pasta. And she explained because many of her kids didn't get any food over the weekend. And she cooked pasta because she wanted to give them something that she knew that they would eat. Something that she said would stick to their ribs and something that would fill them up. Things got real quiet on that set. But she went on to tell us that she would stuff children's backpacks with food to make sure that they had something to eat over the weekends. And just remember, this is a woman who made way less than $50,000 a year and had a family of her own. And she told me that by the time Monday came, that her kids had such hunger pains that they couldn't think about school or tests or learning. Like, that was the least of their concerns. And the data supports what she's saying. The devastating fact is that this is true across our country, and it's absolutely unconscionable. A culture of health and wellness is not just about fruits and vegetables. It's also about hunger. We have to have these issues come together. And make no mistake, there's this crazy misnomer that people who have less money don't want good food or don't want produce. That's just crazy talk. It's got to stop. But let's just take education, since we were talking about schools. And I'll sort of frame it how I would want to say it to somebody who cares about education, because it's really important that we have a lot of people who think education's the most important issue of all issues. And we want them fighting for that. So if I'm speaking to a group of educators trying to convince them to join our coalition or allow us to join theirs, I would really talk about the impact of hunger and poor nutrition on a kid's ability to learn. And let's call this young child Allison, for example. Let's say she's 6 years old and she's smart as a whip. And maybe we'll focus, for the sake of the conversation with the educators, on the most important meal of the day, breakfast. And that if she's going to school where serving breakfast to all of the kids, or all of the kids are getting a nutritious breakfast, regardless of her income, we know here's what follows. She's going to get a nutritious meal that's more likely to have fruit and milk and lower in sugar and salt. Her rates of obesity are going to be less than the average child. She's going to have to visit the nurse less. Her behavior is better. She will suffer from lower levels of anxiety and depression. She's going to have better attendance. She's going to show up on time. And most likely because she's got a good breakfast there. The programs who make sure our kids are getting a good breakfast, they're saying math and test reading scores go up by 17.5%. Now, I haven't heard of too many education interventions that in one swoop can see those kind of test scores go up by 17.5%. Part of the reason, a huge part of the reason why our politics fails on these issues is because the people who have a stake in them aren't voting. And so long as that continues to be the case, we're going to continue to fail to meet the needs on a policy and politics level of these issues, which are affecting so many people in this country. We have to get more engaged on these issues. This organization is doing incredible work, and it's work that needs to be supported.
And when I think about this program, creating a culture of health and wellness for everyone, I think of food justice, achieving food justice, where everyone in our community, regardless of race, ethnicity, identity, or socioeconomic status, can exercise the right to know, grow, and eat nutritious and culturally appropriate food.
They said health and wellness looks like healthy relationships. It looks like having a sense of purpose and meaning. It looks like having access to basic needs like nutrition. Physical health didn't even show up in the top 3. It was number 4. But I think as a community, we know that if we can get those 3 right, we're going to get a lot more right. Medical care didn't even show up in the top 5. And when I asked my own ailing mother, what does health look like to you? You know, she got it right too. She didn't say, well, I think that means reducing the 30-day post-hospital death discharge rate, right? She said, I want to be able to hold that great grandbaby of mine. I want to be able to be lucid. I want to be able to see him and talk to him. And she knows that what that means is that there are lifestyle changes that she has to take on to be able to do that. So what health and wellness and a culture of health and wellness means to me, I think, is listening and redefining health in the form that as communities we know is important, and reallocating our resources to make sure that we can achieve those goals.
I represent the district with the #1 amount of families on federal food assistance. You might think it was somewhere on the west side. No, it's right in Spokane. I represent a place where people are going to our hospitals, and because of the zip code kids are being born in, they're being told that their life expectancy isn't going to be as long as most. That they're not going to get a high education level, and they're going to not make a lot of money. And that's not right. That's not the American dream we all bought into, but we need to level the playing field. And it's from a selfish point, too, when we look at what we're feeding our kids and what they're getting. I'm a parent of a 5-year-old and a 2-year-old, and this is, as Sam stated, this is the first generation that is slated not to outlive their parents. That's scary. That's a national crisis. We should all be concerned with this obesity and diabetes epidemic that we're facing.
And I'm very proud that our hospital, Seattle Children's, is really taking on this issue of healthy eating, active living, and nutritious foods as a holistic and whole strategy to try to enrich communities a little more. 1 in 5 kids being hungry is 1 in 5 kids too many, right? We cannot accept that. That's not the America that I believe in. 75 or 80% of the families we serve are on Medicaid, which means just about every family we serve deals with food insecurity. Just about every family. That's a really difficult thing. It's also important to remember that there is this strength and resilience and energy in these families and in these kids that you see every day. We were talking a moment ago about how sometimes it becomes more difficult to see the last week or so of any month go by. And you know exactly why that is. That's because the limited amount of food that was getting a family through the first week or two sometimes runs out. And it's that second 2 weeks that become really difficult. And I don't even want to do the study that shows the increase in difficult challenges in schools and higher rates of anxiety and greater stress that you can read on the faces of families and kids when they walk through those doors when it's April 22nd compared to when it's April 3rd. I can't talk at all about other issues of health, about important ways to help them learn better, about other chronic diseases, if I can't look a family in the eye and say, you need a food solution. We need to be part of the solution to think about food, that food is health. There was never a difference, only in the structures that we've built around them.
What we're talking about here is both a moral and an economic imperative. And one of the key challenges, I think, is that there remains a disconnection between where the resources that we're spending, you talk about 40% food waste, you talk about the fact we do have an abundance of resources, but there's a disconnection between where these resources are available and where they're being consumed.
So, I mean, that's one of the reasons why I feel that education and advocacy are supremely important. Education so that we can empower those communities to really exercise the ability to not only make better choices, but make better choices without having to leave behind or do away with what's culturally relevant and culturally sacred to them. And then advocacy so that we can get to a place where we're not just talking about change in what's in the food box, but we're also talking about change at the ballot box.
Nancy Amadei, who taught at the University of Washington, runs the Citizen Engagement Project, and is a former president of the Food Research and Action Center. She's the woman who told Reagan that he was making ketchup into a vegetable. She's an amazing woman. But she talks about just like in your everyday life, one thing to do, because it's all about educating people. And she talks about how when you're riding on the bus and you're riding with a friend, maybe sit a couple seats over from them and say to them, hey, you know what I heard Congress wants to do? They want to turn SNAP into a block grant program. And your friend could be like, what does that mean? And you can answer back, it means taking away flexibility from this program. It means basically explain this issue, and the conversation you're having just 2 seats down means that everybody around you is hearing about it, is getting an education too.
And to Sam Kass, our keynote speaker tonight, to each and every panelist, thank you very, very much for the ideas that you brought forward and for the advocacy that you are participating in. There is an activist in all of you.